Doctor, let's talk about cancer a little bit, specifically breast cancer. Do we have a handle yet on how that develops in the body?
I don't know that we know exactly what causes it. I know that we can look at heavy metals, we can look at viruses. There are chemicals that cause it, and like I've said previously, I believe that many breast cancers start in iodine deficient tissue. It takes 3,000 micrograms a day or 3 milligrams a day to maintain healthy breasts once your body's totally saturated. So it's kind of an interesting analogy that I talk about sometimes in terms of breast cancer and how it starts. We assume that it starts from one rogue cell, one thing that starts to develop abnormally, and we're not sure why. I mean, does it get turned on by a metal, a chemical, a virus? Something turns it on. And as that one cell goes to 2 and to 4 and to 8 and doubles, imagine that that cell started sitting on the ocean floor. And each time it doubles, it's a balloon that's going closer and higher to the surface. It takes 7 to 8 years before it gets to the surface of the ocean to where the mammogram can now see it. So you've got a long window of opportunity in here of developing blood vessels, heat, inflammation, nitric oxide exposures, all sorts of things where you can see this evolving tumor that's growing, but you don't see it until it's picked up by a mammogram some years later. Statistically, right out of the medical textbook called Breast Imaging by Dr. Daniel Kopans, which is an amazing book, he shows statistically that the fastest growing tumors, that period from the ocean floor to where mammography can see it, is 3 years. The slowest growing tumors, for which most women die with, their tumors and they actually die from something else, and they see the tumor on autopsy, can be 21 years. So the message I always give to women about if you end up with a bad mammogram, you go and they're concerned or maybe they think it's cancer, the very first thing you need to do is just to sit down and take a deep breath. This is not a 5-alarm fire. It's been going on for a very long period of time. It's not an emergency. You're not having a heart attack, a stroke. You're not bleeding to death. You're not having an asthma attack that you're going to suffocate. You have time to get your thoughts, your mental and emotional, spiritual side together. You need to make some decisions like, if this turns out to be cancer, or if it is cancer, how do I want to deal with this? Do I want to do all conventional medicine because I'm scared and that's what I want to do? Do I want to get some second opinions once inside of conventional medicine? Do I want to have conventional and alternative medicine? Do I want to just do alternative medicine? Do I want to explore some options outside the country? Do I want to look at medical tourism and go someplace else where they may have some more progressive types of treatments in other countries that aren't allowed here in this country yet? So you've got some time to make those decisions, and it makes me so sad when I hear stories of women who they have a bad mammogram, that day they get a biopsy, and 3 days later they're having surgery, and then they're in radiation and chemotherapy, and first thing they know, it's like, gosh, I didn't even realize I had an option.